Welcome, welcome, welcome to Health Issues. I'm your host, Chris Sylvain, and truly excited today. Black Women's Health. There's a major Black Women's Health Conference coming up at Tulane University, and we're going to talk all about it, but particularly, we're going to give you a new perspective on Black women. We have awesome guests, believe me, one who I'm really excited about as a researcher, as a thinker, Dr. Nghana Lewis. How are you?
Hi, how are you?
I'm excited. You know, always good. She's been on before. Have her on again, and we'll have her on again.
Yeah.
Before we even get started, let's just shed the light on the conference. Tell us about the conference, because that's what we want people to be a part of.
Okay, great. The Black Women's Health Conference at Tulane University is our inaugural conference, the first year that we're hosting, and we're excited. It's February 24th through the 25th, Friday and Saturday. It kicks off with an inaugural keynote address by Dr. Takesha Charles Davis. Yes. And we have several panels that are lined up to take place. We're going to introduce some young people who've been actively involved in organizing the conference.
Great.
And who are going to help us in terms of memorializing some of the events so that we can package it and get the information back to young people in our high schools. Right. We have several organizations locally that will be participating in terms of providing information about what they do. And so we're just really excited.
Okay. February 24th?
February 24th, 25th.
What time?
The event kicks off with the keynote luncheon, as I indicated. That's at 12 noon on February 24th.
Okay.
The events for that day run until 7 o'clock that evening.
Okay.
And the next day it's day long. Registration begins on the 25th at 9 o'clock. Okay. And the first, the plenary address is going to be at 10 o'clock that morning.
Great.
The conference will run through 4 o'clock on February 25th.
Fantastic. February 24th, 25th, and it is at Tulane. Where at?
Okay, so we're on the uptown campus of Tulane, which is most people situated along St. Charles, but the campus extends all the way to Broadway. Right. And we're actually on the Broadway side of campus between Newcomb Hall and the Myra Rogers Memorial Chapel.
Okay.
And we're also going to be on the Zimple Quad, which is right behind Newcomb Hall. Okay. So it's all in the same area, but just 3 different parts of the campus within walking distance of each other. Fantastic. On the Broadway side, though? That's correct. On the Broadway side, where Broadway and Zimple intersect, quite literally.
Hey,
we have a conference website, www.bwhconference.com, where individuals can visit and register. They can pre-register, or they can register on site, and they'll also find out the conference agenda and just some of the background related to the conference and how we've come to where we are now, and excited to host the first conference on Black Women's Health. Awesome. So that website again is www.bwhconference.com. Black Women's Health Conference, bwhconference.com. You guys are organized. I love it. That is fantastic. Tulane, and I've talked about it before, hosting, but it's a solid group. You guys have gotten together. You were talking about the history of it. Kind of researchers across the spectrum. That's right. The history of, I'm actually really proud of our history to be able to talk about it. Because there are a group of faculty at Tulane who have always been connected through social events and just keeping in touch with each other and being a support system for each other, because we are all African American or affiliated somehow with Black communities or communities of color in terms of our research. And we've talked about trying to identify some issue or some theme or some way that we could come together and begin to inform each other through some organized initiative.
Right.
The faculty cut across all of the schools. The only school that's not represented in our task force at this point is the School of Law. But we have individuals within the School of Law who we are certainly in communication with. But formally, the task force is comprised of faculty from the School of Social Work, the School of Science and Engineering, the School of Public Health, the School of Liberal Arts, and that's all of the schools, essentially. The School of Medicine, we have a Dr. Renee Mathis, who is on the task force. And we came together, we started meeting in June of 2011. So we're not quite at a year, but we'll soon have an anniversary. And after some dialogue about what issues are common to us and themes that are common to our research and our teaching, we decided that Black women's health would be the organizing concept. And so we started meeting, and we started inviting community members to be part of the dialogue, and in fact, there were a number of individuals who responded. The task force solidified, and we began formally planning our first event, the conference. And actually, we adopted the idea that we would have this as an annual event. Wow. This year's conference, our inaugural one, we're bringing into focus our local resources. And what we mean by that is that there are several individuals in our community who are doing the kind of work around the issues that are important to us. And so why not start by bringing those individuals to the table, and then from there build on that very strong foundation that we will establish with our local resources. You happen to be one of them, a tremendous one of them. And from there, we will begin to, in subsequent years, broaden the conversation by bringing in top practitioners and scholars and the people with the knowledge and the resources and the skills who can come to the table and help to direct us and guide us through the conversations.
Let's talk about this conversation. Let's talk about the problem that we're addressing. Give us a little color to the problem.
The opportunity is a very simple one and a very important one for us to seize upon in this moment. It is the opportunity to come to the table, practitioners, researchers, vulnerable populations, so-called vulnerable populations, and people who may not have particular challenges, but who have some perspective to bring to bear upon the concept of Black women's health, to come to the table and to begin a serious dialogue. The conference theme, who we say we are, what they say about us. We're setting up a tension that really does exist when we reflect on some of the challenges that have extended from what we know to be factual about health disparities that disproportionately impact African American women. So when we talk about smoking cessation, when we talk about obesity, when we talk about breast cancer, when we talk about HIV, AIDS, we know that African American women are disproportionately impacted by some of these conditions. Mm-hmm. At the same time, what we feel and what the task force in our early conversations, what became very clear to us at the outset was that the research, how research about African American women frames the conversation, it could benefit from that framework, could benefit from some input from Black women themselves.
That's good.
Yeah. And so that's what we're seeking to do by setting up the conference as one that is attempting to bring into dialogue both the research and the actual voices or perspectives of people who are informed about what Black women experience on a day-to-day basis that the research sometimes just doesn't capture very well.
Well, and it wouldn't be those researchers, well, could it be? It wouldn't be those researchers' responsibility. It would fall more so on those true stakeholders to enlighten the research community.
You're absolutely correct, and One of the challenges in that respect, of course, is how to go about doing that, informing the research. It is a challenge that we will speak to is how funding, for example, gets channeled, where it's channeled. Within an academic context, I have to tell you that, quite frankly, we can look at the data and it shows that disproportionately the people who are actually doing research about black women are not black women, or are not researchers who are coming from a within perspective. And so that's a challenge, right? We want to be able to say that there are at least the opportunities for these stakeholders to come and to be invested and to be supported in bringing those perspectives to bear. But that's a challenge that we faced historically as a community. It's not just the issue or the concept of black women's health that has had that challenge, right, of others coming in and setting the tone for the conversation. That's been a challenge for our community as a whole for a while, but we're pushing back against that, and we have made measurable progress. This conference is one of those indicators of the progress that we're making.
Because I'm sure the flip side would say, okay, control the conversation. Tell us what you think.
And so, yes, we would want then the opportunity, and I would, again, with the conference is attempting to support is a dialogue. And in a dialogue, there is no control. There would be exchange, free exchange and openness to modification, adjustments as is necessary. I think it's noteworthy to use as an example the population of women, African American women specifically, who may be very well educated, who've attained high degrees of success, but who have challenges themselves in terms of health. How is that the case? If you're not socioeconomically challenged, the conventional indicators don't apply to you. Why is it that you're still at risk for X, Y, or Z? That suggests very strongly that the conversation has not been such that you are alert and aware to the fact that you could easily be at risk, even if you have everything going for you, on a financial level, on a spiritual level, in terms of where you are geographically.
Right.
Yeah.
And I think for many in the academic world, they'd see it right off, but outside, where the research dollars go controls the research, and the research dictates policy.
That's right. That's right.
And policy dictates budgets.
And in turn dictates programs and what's available, access, information, how it gets, again, how the conversation gets framed. Absolutely. So there is a kind of domino effect, right, where, so how do we counter that? How do we bring balance to that? We certainly have to be practical and realistic about one of the needs. One of the needs is, of course, to have an investment in this kind of initiative, right? You have to have investments, and it has to take on multiple forms. And we think that to this point, we hope that with this particular conference, with this initiative, we will be able to show that there are multiple stakeholders who are willing to come to the table when the opportunity is presented to them to do that.
Okay. Next question. For those that are listening and watching, this conference is for everybody.
This conference is for everybody. We believe that everyone, upon reflection, will invariably come to the conclusion that they're a stakeholder in black women's health.
Okay.
Now I'm biased, but I will tell you that my bias is not with historical grounding. You know, there are a lot of myths that organize around Black women, Black womanhood, and you know, I tend to shy away from stereotypes and myths, but I will tell you that there is also evidence to show that historically Black women have in fact been sort of behind the scenes. If we think about some of the major movements, very little gets accomplished if we don't recognize and acknowledge that Black women as thinkers, as movers, as shakers, as organizers, as planners, as supporters, that they're needed. And we want to make sure that in continuing to make Black women available to do the things that we've historically done and to be able to do those things well and to benefit the health of our community as a whole, that Black women themselves have the capacity, the wherewithal, the knowledge, and the understanding that is needed to continue to foster our health and well-being.
Well, I think what's so interesting about the whole conference is that it totally destroys the stereotype of the Black woman.
And that's what we're setting out to do. We're absolutely setting out to debunk the myth that Black women are just those strong Black women who can withstand and sustain anything, because Black women are in fact vulnerable to various health issues. But you know, the interesting thing about that is we want to avoid stereotyping, and at the same time we want to acknowledge how those stereotypes have worked to shape and to inform how society as a whole responds to African American women. And I'll just give you a very brief example that might resonate. We know about the particular challenges that our First Lady has experienced, right? With respect to her own initiative, the MOVE initiative, some of the backlash and the comments that have to do with her particular body composition.
Exactly.
We know the challenges and the stereotypes that organized around her during the first campaign. You know, she's an angry Black woman. Right. Those stereotypes and that kind of rhetoric has, we know, an impact. Whether it's manifested is irrelevant. We know that it has an impact because of the relationship between rhetoric and what's going on inside. Now, I'm not going to speak for our First Lady, but I will tell you that we can go to churches and we can talk with our sisters in the context of faith, and know that when we're testifying on Sunday, right, that's our opportunity to voice some of what we've kept inside. And so that outside strength is there are some vulnerabilities there. The conference gives us an opportunity to talk about what that means. On balance, when we have this conventional notion of Black women is very strong, on balance with what's going on frequently inside, with our young men. And just again speak briefly to this point with our young men, some of the challenges that our young men face. I like to look upon those young men and say, yes, my brother, you are in a very difficult position. If we talk, for example, about the criminal justice system, I like to look at him, and I also like to try to find the woman who's behind him, whether it's a mother, a sister, a spouse, somebody's behind him. Invariably, that's going to be a sister, and she's also struggling with what's going on. So it has wide-ranging implications, and we want to talk about those things, bring them to the fore, talk about them, and then we want to begin to act. So that's another aspect of what we hope this conference will accomplish. We want some takeaways, right, from the conversations. We're going to video every session, and we're going to go back as the task force. We're going to go back over the sessions based on the questions that we receive from the audience members. We will do follow-up and begin to set our own agenda so that we will begin to say who we are in very formal ways, and again, bring some balance to the who we say we are, what they say about us theme.
Absolutely fantastic. Because when we think about Black women, again, the stereotypes, where we can't depend upon Hollywood, we can't depend upon the media to frame who black women are. And in fact, if we continue to do that and continue to wait for them, to wait for the 5 o'clock news or the 6 o'clock news or wait for the sitcoms to frame who black women are, I think we'll be going on for centuries. It just won't happen. So,
you're right. And we know there's a precedent for that. We know that there has always been a challenge in terms of participating in, I was about to use the word control, but participating in that process of establishing who we are. And being able to underscore the fact that we're not just one, right? We're not this monolith. We are, in fact, diverse from within. If we look within, black women are, of course, diverse. But there is the reality in terms of the health disparities that we are disproportionately impacted by a number of health issues. How do we deal with that reality? At the same time that we work to complicate the rhetoric, to complicate the discourse, the dialogue, to complicate the images that we see on the big screen and on the television by introducing more of that diversity and complexity into the conversation.
So it would be different if everything was benign, but the fact is those images and the way in which the framing, the studies, the research affects women's health.
Absolutely. Absolutely it affects women's health. Again, we know this because we have the testimony, right? And I mean that both literally and metaphorically. Testifying has historically been a way for African American women to underscore the extent to which what you see is not always, like the physical, right, the external, right, is not always representative of what's really going on inside. Right. And there's a particular challenge because of the expectation, right? If you've always been Zora Neale Hurston in Their Eyes Were Watching God, Nanny, Nanny told Janie, black women are the mules of the world. Well, you know, we talk about the mule. We know from a biblical context that that's a beast of burden that can withstand anything. And that's a powerful image, right? There's also the other aspect of that, you know, a beast of burden and just continually manipulated and abused and used, but still standing. So how do we negotiate that, right? That black women can withstand anything. And therefore, you could put anything on black women. Well, we got to work on that because acknowledging that black women are strong is one thing. It's important. But that doesn't mean that black women are not vulnerable. And so how do we balance those two things? I like to embrace the metaphor of the mule because of the strength of the mule that's associated with the mule. But a mule is a beast that it is a beast that has historically been abused.
Well, I think we can look at it right away that the concept of the mule, but looking at humanity and looking at life, love, concern, sensitivity of somebody that should be cared for, not because of weakness, but because of life.
That's right. That's right, because
humanity,
of life.
And it's just necessary that it shouldn't be anybody that people should dump upon. That becomes abuse. And so abuse, if we normalize abuse, if we in any way, shape, or form create an image that can normalize abuse, and then little boys learn to be abusive,
yes,
and society learns to be abusive, and so even to the extent where we're fighting for African American men, do we still leave it whereas African American women can be abused because of the situation? It's nutty.
I like what you're saying. I like what I'm hearing, because it captures well the challenge, I would say, or the opportunity that we have to put it out there and to say that perhaps we need to bring greater parity to how we approach what our community recognizes to be some of its greatest challenges. So yes, we want to acknowledge that our young men need assistance, need guidance, need help. How do we do that in a way that doesn't silence black women or close the door in terms of addressing the issues that also impact black women? How do we do both at the same time? You know, how do we do that? I hope that the conference will give us an opportunity to memorialize some things as it relates to next steps. This is how we do it. This is how we can do it. This is how we will do it.
And in fact, I think what's so amazing is that, as people are listening, from this perspective, from researchers, you guys are top researchers, from a researcher perspective, from those that have studied, you're approaching this thing holistically. It's not from a, you know, black women's health, it's not like we're dealing with high blood pressure, particularly in and of itself. It's not in a vacuum because we can, okay, they just need to take more medicine, you know, more hydrochlorothiazide, and okay, that'll take care of the blood pressure. No, we're looking at the environment in which she had high blood pressure. Why is she dying earlier? What's going on? Let's look at the criminal justice system, everything. In fact, let's look at the media. Let's look at everything.
Absolutely. Holistic approach. You've got to, yeah, absolutely. The concept of black women's health is a complex, right? It's a complicated concept. And so how do we break that down? It's complicated, but it's fairly easy to recognize, I think, once we start that dialogue, to see how an image of a black woman that is perpetuated, that's framed and that gets perpetuated and reproduced over a long period of time in media and is one-dimensional, how that image can in fact have an impact on the psychological, mental, emotional well-being of black women. Just as easily as we can recognize what the data shows or what the evidence shows if you take a high blood pressure test and you see that it is 140. I don't know what the numbers would be, but you know what I'm saying.
That's right. Stop right here. February 24th, 25th, starts at noon on the 24th.
That's right.
Okay. Tulane University on the Broadway side.
That's right. Broadway and Zimple.
Broadway and Zimple. Dr. Nghana Lewis, awesome. Chris Sylvain, Health Issues, healthissues2010.org. You'll be able to link on to that website from our website. Fight as hard as you can. Stay strong. African American women, work hard. Thank you. We love you. Appreciate you.